Good evening, everyone. Manipal Hospitals Delhi, in association with Health DNA, welcomes you all to a small chit-chat session with Dr. Peush Bajpai, who is consultant medical oncologist here at Manipal Hospitals Dwarka. As you can see on our Facebook page, we have this campaign which is running called Battle the Big C, as in the big cancer. We see a lot of cases today, especially in young generation, that they are suffering from a lot of diseases related to lungs, or maybe on the bigger side, lung cancer. So with Sir here, we would like to ask certain questions as to, Sir, can you just start with a small basic question with everybody asks, that what is passive smoking?
So, Tanya, you rightly pointed out a very right question. So, somebody who does not smoke and thinks they cannot get lung cancer, probably it's one of the biggest myth, because somebody who's not smoking and is in the vicinity of a smoker, though is a non-smoker himself or herself, but is actually a passive smoker. And a passive smoker inhales the breath more deeply, subconsciously they are doing their normal breathing. Unlike the smoker who actually takes in the cigarette smoke and would exhale it immediately out, because the cigarette smoke would be an irritant down in the lungs. But unlike the passive smoker would push the particulate matter in the smoke or the cigarette smoke down deep into his or her lungs. The examples are like a child sitting in the vicinity of his father who is smoking, or ladies in the vicinity. They might not be smoking, but then they turn out to be passive smokers. And because the particulate matter goes down deep inside the lungs, the chances that there are more mutations happening and the chances of regular such exposure predisposes them to have this sort of lung cancer early. In case of a child, the lung cancer, what we see these days, is actually happening a decade earlier than what we used to see some time back.
Okay, so very informative. But sir, जब हम lung cancer के बारे में बात करते हैं, is it necessary that somebody who is smoking is bound to get lung cancer, or somebody who is a non-smoker, can he also get lung cancer?
Well, somebody who's smoking is definitely on a sure shot right for a lung cancer. There is no doubt about that. I mean, it does matter on the number of pack years, but yes, there is definitely no significant cutoff. If you are smoking 1 pack a day or probably lesser than that, it does not guarantee, that a lesser smoke would probably prevent lung cancer. But for somebody who's a non-smoker, and that is what I said, passive smoking, you are actually standing in the vicinity of somebody who's smoking. You are living in the vicinity of somebody who does that. So there, definitely what we see, that non-smokers come to us and ask, कि हमने तो अभी तक सिगरेट का सेवन नहीं करा था, पर ये कैसे हमको हुआ है? तो एक तो कारण है कि जो है passive smoking, because they stay in the vicinity, वो उसके पास रहते हैं जो कि कोई स्मोक कर रहा है. और दूसरा कारण जो है हमको आजकल देखने को मिल रहा है, that the particulate matter in the air environment in all the metro cities are very high. So because of that, somebody who is not smoking and living in a metro city does predispose that yes, there is a chance that you might eventually be inhaling those toxins.
Right, sir. So how common is lung cancer these days?
Well, talking about lung cancer, it is definitely one of the commonest cancers that what we see. Around 6.3% or 6 to 7% of the cancers diagnosed in India are lung cancers. And when we talk about this worldwide, nearly 18 lakh patients of lung cancer are being diagnosed on a yearly basis. Okay. So it is that common. And it is definitely the #1 killer currently, whether we look at the worldwide statistics or whether we look at the Indian statistics. Also, it is not just common in males, but it is actually showing a very surprising and a drastic rise in females as well. So one reason I stated is passive smoking. The other reason could be definitely attributed to the sort of air that what we are breathing.
Right, sir. So, sir, there is it like necessary to get yourself screened since we are staying in a metro city and it is said that like breathing in Delhi is equivalent to smoking 7 cigarettes a day. So, is there any screening tests which are available which you can get them done on a regular basis? And are there any screening tests to be done for lung cancer?
Well, before I come to the formal screening test, I must tell that somebody who is actually having a chronic cough, and a chronic cough is defined as something 2 to 3 weeks. किसी को भी जो है खांसी आ रही है बराबर 2 से 3 हफ्ते तक, so वो पेशेंट को जो है जाना चाहिए रेगुलर एग्जामिनेशन के लिए, एंड एक एग्जामिनेशन के लिए अपने चेस्ट फिजिशियन के पास या अपने फैमिली फिजिशियन के पास. There could be a possibility that it is related to some ordinary bacterial infection, could be tuberculosis, which is one of the most prevalent diseases in India, but lung cancer cannot be ignored. So lung cancer should always be kept in mind if there is a chronic cough, and the physicians do look for it. The starting investigation is usually a chest x-ray that it starts with. Talking about a formal screening program, well, we do not have one, but then there are guidelines now that state that after the age of 55, somebody who has been a smoker, who has had smoke around 20 pack years and above so far, and is having a life expectancy of more than 15 years. So from 55 years to the age of group of 80 years. So there, somebody who wants to check or screen themselves whether there is a possibility, because these are high-risk individuals, they have been smokers, and therefore these individuals can undergo an annual CT scan. There is a type of CT scan. If you go and talk to the doctor, the doctor would recommend you that this is a sort of CT scan which is to be done on a yearly basis. So it is done on a yearly basis. The chances in India are in India, the challenge is tuberculosis. So tuberculosis mimics cancer in the sense that कि tuberculosis का जो दाग है वो कैंसर के समान दिख सकता है CT स्कैन पे. तो उसको नेक्स्ट स्टेप जो रहता है वो बायोप्सी करने का रहता है, जो भी अगर कोई निशान CT स्कैन पे दिख रहा हो. सो कई बार जो है हमको फॉल्स नेगेटिव्स भी देखने को मिलते हैं कि जो है वो जो हम सस्पिशन कर रहे थे कैंसर का वो नहीं आया, और उसी प्रकार से हमको कभी-कभी जो है कैंसर भी पकड़ में आता है.
So we have questions from our viewers. Shruti पूछ रही है, what are the early signs of lung cancer?
Well, early signs of lung cancer, as I already mentioned, that cough is one of the signs which we should be looking for if it is chronic. And chronic cough, one should actually approach their doctor. This could be any common infection, bacterial infection, pneumonia, but there could be a possibility, especially in somebody who has been smoking, a smoker, that the chance of lung cancer could be there. And therefore, cough is one particular sign. The other is if there is any blood in sputum coming, that is another sign of alarming sign, which could again be indicating towards lung cancer. Then could be a weight loss in a smoker. There happens a weight loss, that could be a sign of lung cancer. So these are some of the signs which could indicate any particular change in voice. There is a hoarseness which starts after, especially again in a smoker. Then one should not neglect it, and one should get examination. Along with the ENT examination, a chest X-ray should also be considered in a smoker.
Okay. And so, one of the viewers has asked that if by chance you were smoking, you were an avid smoker once, and then you have quitted smoking, and after some time, is there a chance of him or her getting lung cancer?
Well, Tanya, you rightly said the important point over here is quitting smoking at any point of time should be encouraged, because the day you quit smoking, all the side effects of smoking or the problems of smoking start coming down. and the chances that you get those particular disease patterns, the incidence and the the probability of it starts coming down. It's a downward curve. So definitely stopping smoking is a good idea any day. Quitting smoking is a good idea any day. Therefore, one should focus, smoker should focus probably on quitting any day. There should not be any repentance that the probable side effects would not be there. So it would come down, but yes, even after quitting smoking, there would always be a small chance which would be higher than the general population who does not smoke to catch lung cancer, to get lung cancer.
There's this another question that we have got from Shimona. She says, "Hello doctor, how do you determine how far a lung cancer has progressed?"
Okay, so checking how far the lung cancer has progressed, in other words, staging lung cancer, what Shimona wants to ask is you actually look whether it has not gone beyond the lungs, and we usually consider doing scans for this. Usually it is a PET CT scan, which is available with us, or probably a CT chest and an abdomen along with a bone scan, and sometimes MRI brain as well. So this is all a set of investigations required to check whether what is the stage of lung cancer, if that is the question.
This is another question, sir. Are there protective factors for lung cancer?
Well, the protective factors for lung cancer are definitely quit smoking. The moment you quit smoking, you would be in the gamut of protection. That is secondary prevention, probably. Talking about other factors, yes, definitely going and breathing, the air outside a metro where the particulate matter is much lesser, definitely might be an option for some, but is not a factor which is commonly I would advocate. Of course, we all as a community should be going towards better environment, and that is something to look forward. That's what I can say. I mean, these are something which we can look at. Of course, a healthy diet in terms of rich in fiber and carotenoids would or might help, but there is no specific evidence for that as of now.
So, how has lung cancer evolved over these years? As in, पहले शायद जो older generation था, they used to get cancer, and अभी it's more evident in the common youngsters. Is there any message that you want to give them, or any preventive things that they should be doing to?
So your treatment has two parts, and one is what your question has two parts. One is what is the current treatment available?
Yes.
Has it improved? So answering your first part of the question regarding the treatment, yes, what was available 10 years back, 10 साल पहले जो हमारे पास medicines थी, जो diagnostic facilities थी और जो surgical techniques थी, वो आज की तारीख में काफी सुधार आया है उसमें. हम आज की तारीख में targeted therapy, जहाँ तक medical oncology का सवाल है, medical oncology chemotherapy से बढ़ के आप cancer specific cancer का DNA जानने की कोशिश करते हैं, और जिस प्रकार का DNA होता है उस प्रकार से जो है वो पर्टिकुलर टारगेटेड थेरेपी देने की कोशिश करते हैं. टारगेटेड थेरेपी अक्सर टैबलेट के फॉर्म में उपलब्ध होता है. सो इंजेक्शन ना लेके, कीमोथेरेपी के इंजेक्शंस ना लेके टारगेटेड थेरेपी टैबलेट से कैंसर का इलाज करा जाता है. दूसरा जो ऑप्शन होता है वो इम्यूनोथेरेपी का होता है. इम्यूनोथेरेपी हमारे अंदर की जो लड़ने की क्षमता होती है, इम्यूनिटी होती है, जो आमतौर पे बैक्टीरियल इन्फेक्शंस और कैंसर से लड़ती है, उसको हम जो है वो दवाई देके जागरूक करते हैं, और इम्यूनोथेरेपी से बेसिकली कैंसर को लड़ा जाता है. अगेन इम्यूनोथेरेपी का एडवांटेज ये है कि जो साइड इफेक्ट्स हमको कीमोथेरेपी के दौरान देखने को मिलते थे जब हम कीमोथेरेपी देते थे, वो उस प्रकार के साइड इफेक्ट्स इम्यूनोथेरेपी में नहीं है. क्वालिटी ऑफ लाइफ जो हम कहें, लोग अपने ऑफिस भी जाते हैं, लोग अपना दिनचर्या बिताते हैं. So immunotherapy has definitely brought in that particular aspect of quality of life. It is much better than what we used to see earlier with patients who were getting therapies. The second part of your question, if I'm sorry, what was regarding the prevention, and I already answered that. Prevention, you can probably consider definitely quitting smoking at any particular point of time. The smoker should always be looking for the positive side of quitting smoking, and that is definitely there.
Let's see if we can get another question. There was a question which talked about small cell lung cancer.
Okay, so what are the types of lung cancer? As I can see, one more
Yes,
question.
yes.
What are the types of lung cancer? Well, earlier lung cancer used to be differentiated between a small cell lung cancer or a non-small cell lung cancer. The description was basically a microscopic differentiation. हम माइक्रोस्कोप में देख के कहते थे कि जो है अगर ये इसके सेल्स कैंसर के सेल्स राउंड हैं और छोटे राउंड सेल्स हैं तो बेसिकली वो स्मॉल सेल लंग कैंसर की कैटेगरी में आते थे और दूसरा प्रकार के बाकी अन्य प्रकार के कैंसर्स को नॉन स्मॉल सेल लंग कैंसर कहा जाता था। उसका अगर हम आज की तारीख में डिफरेंशिएशन देखें तो आज की तारीख में nearly 20% are small cell lung cancer which are diagnosed and 80% are non-small cell lung cancer. Amongst the non-small cell lung cancer basically are adenocarcinoma and squamous cell carcinoma. Adenocarcinoma, again, after the filtered cigarettes have come into vogue, basically we are finding more of adenocarcinoma actually happening. Why? Because the smoker actually takes in the breath deeply. Adenocarcinoma is something which actually arises from the periphery of the lungs, from the outer surface of the lungs, and a deeper smoke basically causes adenocarcinoma. Earlier, where there were non-filtered cigarettes or BDUs, there at that time the cancer was usually near the central part of the lung or the chest wall. So that usually was a squamous cell carcinoma pattern. And definitely adenocarcinoma is also one of the most common carcinomas in ladies. So yes, adenocarcinoma is one of the cancers which happens in a passive smoker. Small cell lung carcinoma, on the other hand, actually happens in a very heavy smoker. And the outcome as compared to the other subset is not very good.
So can you talk about the treatments that are available in the hospital?
Right from the diagnosis, I would say that once a treatment, once there is a patient of lung cancer, we have all the facilities of diagnosis in Manipal Hospital Delhi, right from doing CT guided biopsy from the platform of an interventional radiologist to a robotic surgery from as far as a surgical oncologist is concerned, and to the latest radiotherapy techniques. Latest radiotherapy techniques are important because lung lies next to the heart, and once a radiation is being given, it is very important to prevent heart being irradiated. The heart should not get radiation, and sparing the heart is very important. So there are techniques now, and there is technology which can actually bring in and spare the normal tissue and actually focus only on the cancer cells. Likewise, in medical techniques, if I'm talking about the modalities are three broadly. One is chemotherapy, which has been there, and now the techniques of giving chemotherapy, the tolerance are all getting better because we have other drugs which are there to support. For example, nausea and vomiting is not seen as was seen 5 or 7 years earlier. Now the level of nausea and vomiting is not seen. Likewise, the other side effects have also sort of improved because of better medications now available. The second is targeted therapy, as I mentioned earlier, that one looks at the DNA of the tumor, and after looking at the DNA of the tumor, whatever any particular mutation is there, that mutation, whether a tablet can be given for that particular mutation, and it actually happens in nearly 40% of the patients that you can actually detect such a mutation. 40 to 50% of the patients might have that mutation. The third medical thing in armamentarium of a medical oncologist is immunotherapy. As I said, it's an injection where our immunity levels are basically increased, and this eventually fights against the cancer. Apart from this, what I would like to say that we on a regular basis are conducting board meetings, and that is tumor board meetings. And these are basically when other departments are actually sitting together, around 20 doctors sit together and discuss about one particular patient, what best we can do for that particular patient. And tumor board actually is the essence of a good cancer treatment. And therefore, every patient should have a discussion. The case should undergo a tumor board discussion. And that's what we do at Manipal Hospitals.
Yes.
We also take the help of artificial intelligence, and that is basically Watson oncology. This artificial intelligence does, most of the times when cancer patients come want an opinion, they probably want another opinion. So this particular artificial intelligence is actually made by people in New York, doctors in New York, oncologists who are at Memorial Sloan Kettering Institute, who actually have made this particular artificial intelligence program. We check that what is their advice and how much our advice does match them. So in a nutshell, we do have facilities to check that we give the perfect opinion and the perfect treatment to the patient.
Very well, doctor. And one more question. Does a family history of lung cancer increases the risk of getting lung cancer?
So fortunately, lung cancer is one of those diseases where 99% of times it is the lifestyle pattern which is important. One's own lifestyle is basically responsible for getting a lung cancer. As I have already said, smoking, breathing air in a metro city probably could be linked to it. And other exposures, as in occupational exposures to fumes, could be a possible factor there. As far as genetic is concerned, it is actually a rare scenario to find. Probably less than 1% of the patients might be having this sort of genetic inheritance. One particular syndrome is Lee-Fromoni syndrome, where P53 gene deletion is there, which is also called the guardian of the genome. There, probably lung cancer can be transmitted hereditary, but then that is something which is a very rare exception.
Okay. We have another question. Does working with uranium in laboratories increases the risk factor for getting lung cancer?
Yes, heavy metals do, and especially the radioactive ones do, increase the risk of lung cancer. There's also an important sort of a situation where cancer survivors who have been exposed to radiation of the lung because of some other reason, probably I would say breast cancer survivors, where the techniques 10 years back were not that advanced, and there was some radiation trickling down to the lungs. There probably there could be a possibility 15 years, 20 years down the line that there could be a possibility of lung cancer. So if any radiation has been done, one should follow, or chemotherapy also for that matter, one should follow their doctors regularly.
There's another question which says that high concentration of asbestos also causes lung cancer.
Asbestos, yes, it does cause lung cancer. It causes lung cancer rarely, but most commonly it causes a type of cancer which is called as mesothelioma. Mesothelioma is basically a cancer of the pleura. Pleura is the lining around the lung, and therefore this is exposure to asbestos has been known as an occupational hazard. Yes, it can cause.
Okay. So, any message or any for the precautions that can be taken to avoid lung cancer?
Well, precautions, as I said, in today's day. Of course, somebody who's smoking in your vicinity, please ask them to quit. Quitting smoking would be, beneficial for yourself as well, and as for the smoker also. The day he starts, the day he stops smoking, all the side effects, all the negative effects of smoking would start coming down. Not just cancer, but also the cardiovascular, the renal side effects, whatever the ill health effects of smoking are, they would start coming down. The second thing is, we all as a community should go towards a green environment. Green environment does not mean shifting your place, getting transferred from Delhi, but then probably adopting healthy practices, avoiding diesel cars, and of course, planting trees could be an initiative by the community. However, would be a small droplet in a big ocean, which we need to work a lot on this.
Yeah. There's another question, sir. Does chronic obstructive pulmonary disease, which is commonly known as COPD, directly lead to lung cancer?
Well, COPD per se does not lead to lung cancer, but yes, scarred lung. COPD can cause scarring of the lung, and a scarred lung can rarely be associated. Not a common phenomenon, but can be rarely associated with lung cancer. Another important point is, most of the times, COPD patients who are suffering from COPD are smokers, and because of that, they have the possibility of getting lung cancer. So somewhere there is a common link, and that is smoking.
Thank you so much, sir. It was a very informative session, and I request our viewers to keep on sending your queries, and stay tuned to our this Facebook live session. We'll be coming back with more informative sessions. Thank you so much.
Thank you.